Can you tell me your name and date of birth?
Suave,
Okay.
January 1st, 1982.
Okay, thank you.
Clean finger, allowing alcohol to dry. Not allowing the alcohol to dry can affect your reading. Turn on the glucometer. Enter patient ID and user ID. Verify the number on the glucometer with a bottle of strips. Check the expiration date of the strips. Remove the strip and put into glucometer. Stick the finger, wiping off the first drop of blood. With a second generous drop of blood, touch gently onto strip. Cover the puncture site with cotton ball or gauze. Apply pressure to the finger. Read the glucometer accurately and dispose of strip properly.
Okay, it says your blood sugar is 250, so I'm going to go prepare your insulin, okay?
Turn glucometer off. Place the lancet in the sharps container. Document the number in the client's chart. Select the vials. Verify on MAR using 6 writes and 3 checks. Rotate NPH for 1 minute. Do not shake insulin to prevent bubbles from forming. Check the expiration date and open. Wipe both bottles with alcohol. Allowing alcohol to dry prevents needle from being coated with alcohol and mixing with medication. Inject air into bottle of NPH. Be sure not to get medication on the needle to prevent cross-contamination with regular insulin. Inject air into bottle of regular. Draw up the dose and check with a second RN.
Okay, my patient's blood sugar was 250, so I've drawn up 8 units of regular insulin.
Okay.
Okay. And the basal amount of NPH is 22. So I'm going to go to 30.
I'll take 30 units.
Okay.
Passively recap and attach medication label. Make sure to administer within 5 minutes of preparing.
Hi, I'm back to give you your insulin. Can you tell me your name and date of birth again?
Suave,
And what's the date of
January
birth?
1st, 1982.
Okay. So I'm going to inject your insulin into your arm, okay? Can you relax your arm for me?
Clean the site with an alcohol wipe. Grab the skin and inject at a 90-degree angle. Release the skin and inject insulin slowly. Withdraw the needle. Wipe with the alcohol wipe. Activate the safety shield. Put the needle in the sharps. Drawing up insulin using an insulin pen. Based on the fingerstick blood sugar, determine the type and the units of insulin. Select the proper pen. Make sure the pen is labeled with the patient's name and medical record number. Check the expiration date. Pull off cap and wipe the rubber stopper with an alcohol wipe. Attach a single-use needle and remove the cap. Turn the dial to 2 units. With the needle pointing up, tap the reservoir a few times. Push the button to see if a drop of insulin appears. Priming the pen removes air from the needle and ensures the correct dose is injected. Check the dose is now at 0. Dial the dose, put the cap back on, and verify with a second RN.
Then it says to dial the numbers.
Okay, I have Mr. Suave's Novolog. His blood sugar was 250, so I drew up
Okay.
8 units.
Okay, 8 units of
Novolog?
Novolog.
Okay. Can you tell me your name and date of birth, please?
Victor Suave, January 1st, 1982.
Okay, Mr. Suave. I'm going to inject it into your arm here.
Remove the cap, pinch the skin, and inject the needle. Press the button on the top all the way in. Keep the needle in for at least 6 seconds to ensure the full dose has been delivered. Keep the button depressed until the needle is withdrawn from the skin. Unscrew the needle and put in the sharps container. Put the cap back on. Document the type, site, and number of units given.